The Daily Bruin spoke with the Ashe Student Health and Wellness Center about upcoming changes to COVID-19 precautions at UCLA.
Hi, my name is Chaitali Mukherjee, and I am the Executive Director of the Ashe Center.
Thank you, Dr. Mukherjee. So just to start, we have a lot of changes with COVID-19 going on in California and LA County. What are the trends looking like at UCLA?
Well, the trends are definitely moving in the right direction. The positivity rates for members of the Bruin community taking the swab-seq test on campus has dipped to 0.4%, which is very consistent with a steady downtrend since the peak of the Omicron wave around the turn of the new year. And the number of people hospitalized at UCLA Health has also diminished rapidly from more than 160 in mid-January to roughly 20 as of late last week.
And with these improving trends from the Omicron surge, what can we expect COVID-19 precautions to look like in the spring quarter?
Well, the COVID-19 Response and Recovery Task Force determined just this week that as of Monday, April 11th, which is 2 weeks after the return from spring break, students, faculty, and staff who are fully vaccinated and boosted, if you're eligible, and are participating in activities on campus, they can opt out of the weekly surveillance testing. So that said, the surveillance testing is still highly recommended, but the exceptions are that students, faculty, and staff who have to remove their mask during indoor music and performing arts, they will still continue to be required to test 3 times a week until the LA County Department of Public Health lifts the requirement for that subset.
And now that the LA County's mask mandate has lifted and some local colleges are lifting their mask mandates, when can we expect UCLA to also join in on lifting mask mandates?
So also on April 11th, students, staff, and faculty who are fully vaccinated and boosted and are participating in activities on campus, they can opt out of wearing the mask indoors as well. We do highly recommend it though, and we've just been looking at the factors that we've looked at throughout the pandemic to make that determination, just the test positivity rates being so low on campus and in the region, available isolation beds, and we're just following the national, state, and local public health authorities.
And what factors went into the decision to keep those 2 weeks from returning to spring before removing the masks?
Well, the idea is really that we just continue to monitor the data and just to ensure that as people are returning because of the movement that may occur due to socializing indoors, traveling, et cetera, that we really just reestablish that bubble and ensure that as we're relaxing these COVID mitigation strategies, that the numbers remain low so we can continue to monitor to ensure that the safety of the learning environment.
Now that masks won't be required after the April 11th for those certain conditions, will those surgical grade and N95 masks still be offered for free for students?
As far as mask availability, free masks will continue to be available to students at various campus locations, including John Wooden Center, the Student Activity Center, UCLA locations, including Ackerman. We're also going to be having masks available at housing at the front desks for all the students who live in the residence halls. Students will just need to bring their Bruin ID at the time of pickup.
And with spring break coming up, are there any precautions that students should be taking? And when people return from spring break, are there going to be any testing protocols like there were in the winter?
Well, during spring break, we are encouraging everyone to still remain mindful of steps to help prevent transmission of the virus. So continue to follow masking protocols whenever you travel. We do discourage travel for more vulnerable individuals, such as those who are not vaccinated, people who are having symptoms or sick with COVID. Those who are awaiting their results may not know their status just yet, or if you've been in close contact with someone with COVID. Now, as far as what our re-entry protocols are going to be following spring break, students who traveled or live in congregate environments, so that includes those on the Hill, in the residence halls, fraternity and sorority houses, and students who participate in the athletic programs, both NCAA and club sports, are going to be required to take a rapid test upon return. And then for those groups, as well as students, faculty, and staff who travel during spring break, then they'll also participate in the campus surveillance testing program, which is those saliva swab-seq tests that you have in the vending machines 3 to 5 days later and at least once the following week. So basically, everyone's in the 2 weeks following spring break is going to need to be tested at least once with a campus surveillance program and then the second week.
And for students who test positive with COVID and need isolation housing on campus, will that be continued to be offered in the spring?
We have 1,216 available isolation beds, and as of the end of last week, only 34 were being used. So that means we have nearly 1,200 available isolation beds. And really, we've seen that the number of occupied beds has dropped steadily and quite quickly since the peak of the Omicron surge.
Now, with 2 years of COVID-19 and social isolation and current global events, what steps can students take to ensure healthy mental health?
Well, I mean, there have been many lasting effects of the pandemic, and there's just a lot of recent and ongoing events in the world, too, that have caused distress to many people in our community. So for any Bruins that are seeking support, counseling services are available for all students through the CAPS, the Counseling and Psychological Services. And CAPS is also offering mental health care packages for all students with self-care resources and tips. And this is definitely a great time of the year to remember that as you're going into finals and then hopefully getting a little bit of rest over spring break and then starting a new quarter. Transitions are always tough, but the support that's available here allows you to develop a self-care plan to prevent burnout, maintain healthy relationships with yourself and the people around you. This time of transition is an opportunity for us to kind of renegotiate our ways of interacting with each other, the boundaries we set with others, and just remembering to be kind and to have your own self-compassion and compassion for those around you who may just be in a different place than you. And so I think we just need to meet people where they're at and really create a respectful environment where, whatever your level of comfort is with how you need to take care of yourself and those that are close to you, just respect that space. And so while it's no longer mandated to maintain social distance or maybe to wear a mask or to test every week, we're still providing all of the resources and the infrastructure is here to ensure that we have a very safe spring quarter, end of the academic year, and hopefully a big celebration for all of these milestones that you all have achieved just to survive this and hopefully thrive and give yourself a pat on the back at the end of it all.